15 syringes of filler in my face, but you would never know.
The reality is, if you look closely at her face, you do know. Just because she thinks she looks natural, it doesn't mean that other people think she looks natural. The normalization of plastic surgery has become a subject of great controversy. Today, we're going to review a video of Jubilee where they discuss the pros and cons of plastic surgery.
I'm Ka Takahashi, and I'll be moderating this episode of Cosmetic Surgery versus Natural Beauty. The first prompt is, cosmetic surgeries should be as normalized as makeup.
Putting on makeup on a daily basis is not equivalent to having cosmetic surgery. Makeup, of course, is reversible. There's very little risk associated with it, whereas cosmetic surgery has significant potential risks, and you can't equate makeup with surgery. That's my point of view.
Can the egregio step forward?
I kind of see a lot of cosmetic surgery as kind of like high maintenance to be low maintenance type of thing. So girls who are overlining their lips every day, like just get some lip filler, like get the, the Botox or anything. I mean, it kind of starts with makeup, like the girls who are putting on the makeup every day before school when they get a little more money in their pockets and they get a little older and get a little freedom. Yeah, those are probably the girls that are a little more inclined to want to get stuff done. It's a little more severe to go under the knife than to wear makeup, but I mean, it's something that happens every day.
This young lady, in some ways, is trivializing the surgery aspect. Okay, surgery is much more significant in terms of its risks. It is true that this woman is correct in terms of where things start. Generally, it's young women who are putting on makeup and looking in the mirror and really analyzing their face and trying to enhance certain features they have. It does eventually lead to them considering having injectable fillers at a later age and then potentially even having surgery. But it's not the equivalent. In other words, doing makeup is certainly not the equivalent of having surgery.
It's LA, and I just don't think people talk about it because it's so taboo.
Originally, the prompt said surgery, and I don't think surgery should be normalized, but then you started talking about like
Botox,
yeah. Lasers, skincare products, friends, and
I don't think you can put skincare products in the same category as lasers and Botox and other injectables. Again, these procedures have significantly more risks associated with them compared with just skincare products and topical cosmetics.
Acquaintances that I know who also are aging gracefully. Somebody gave them the secret when they were in their 20s. Our collagen starts going to shit at 25. So if you're not doing things that boost the collagen in your skin at the age of 25, you're going to be playing catch up at some point.
So I do think that there are preventive measures to preserve our skin quality and prevent sun damage. And that starts with sunscreens and avoiding sun in particular and not going to tanning beds and things like that. I do think that you can use topical medications like Retin-A, which can thicken the skin so you retain more of a youthful glow and your skin it retains more of its health over time.
There's something that you could have done, like regular exercise or stretching every day to help you age better. Why not do that for your appearance if it's simple, safe, and you're doing it with a trusted physician?
But surgeries, you would say, that should not be normalized.
I don't think it should be normalized, but I'll give you an example. This is going to sound crazy, but go with me. So I had a girl brought in by her mom for a labiaplasty. And I was ready to walk in the room and be like, are you freaking crazy? Like, what are you thinking bringing in your daughter for a labiaplasty? And I walked in, and this girl had a normal labia on one side. And on the other side, she had a labia as long as my finger hanging out. When she was at the YMCA, it would fall out of her bathing suit. She was getting teased by her friends. And she said, Mom, I do not want to go into high school with this thing hanging out of my vagina. I did it awake. It took me 15 minutes to give her a normal anatomic labia that matched her other side.
Dr. Nazarian is describing really a reconstructive problem, not really a truly cosmetic one. Yes, it has cosmetic implications, but it's really a reconstructive problem. And once you go towards something like reconstruction, that's a whole different category in my mind. When you do something totally for elective reasons, that's considered to be cosmetic.
I think plastic surgery shouldn't be demonized, but it also shouldn't be normalized totally, completely either. In that way, stealth can also be quite dangerous for people because people are dishonest about the work they get done, and they give this unrealistic beauty standard. I didn't know a lot of girls had BBLs when they were selling workout plans.
Oh,
Things like
totally.
BBLs.
yeah, Brazilian butt lift, which is what I have two of.
Okay.
I don't think plastic surgery is wrong. The little girl you're talking about, we can all imagine what that would be like, having some kind of abnormality in your body, or if you have a cleft lip or something that makes you feel so othered. I can understand that. My issue with the idea of normalizing surgery, you have young girls. When you're 18, you get to decide if you're willing to take on the risk.
There are two exceptions where young women usually make decisions along with their parental guidance, and that is usually rhinoplasty, which is reshaping the nose, is typically done in their late teens, early 20s, and breast augmentation, which usually occurs at that age prior to going off to college or getting a job or whatever, or just engaging with their friends. But again, these decisions are not insignificant. There are certainly risks associated with any of these procedures. Rhinoplasty commonly has secondary side effects which require revisions, and breast augmentation also is not a permanent operation. It has to be repeated again in about 10 or 15 years. It's not something that can be done in a very glib way. It has to be done with a lot of thought, and thought not only about the improvement that it makes, but also about the secondary consequences that may occur as a result of the surgery.
18-year-olds don't really know anything. I don't want a society that tells young women especially, you need to change these things about yourself surgically.
So I think it's very important that we make a
Distinction?
yes, there we go. We got it. It was there. Between makeup and surgery, because that was a prompt, right? I even faced troubles when I was doing certain surgeries, right? And I had to redo things. And I think once you go down that slope and that route, it goes into like another tunnel.
I think what this woman is describing is body dysmorphic disorder, which can occur once the body is altered in certain ways. And some people are constantly seeking what they consider to be perfection, even though they may not have any imperfections to start. It can be a slippery slope. They're constantly trying to revise and change and, quote, improve things, whereas there really was no problem to begin with. And this can lead to a lot of mental anguish and pain and potentially very risky surgery, which can be deforming, and ultimately some patients unfortunately commit suicide, believe it or not.
You know what I'm saying? Makeup, it's something that's so easy we can take it off, we can put it on. So that's the only reason why I disagree. I don't think it should be as normalized as makeup because it's just two totally different ball games.
That I agree with, and I think I've already stated that makeup and surgery are two different levels, and so I agree with this lady.
I completely agree with you, and to a certain extent, I would say, looking at like the makeup industry, makeup in a lot of ways is a little bit too normalized. So I don't think I would want to take that a step further. And if we're normalizing makeup, which in a lot of ways there are women and men who can throw on makeup and it changes the entire shape of their face, and you take it off and it's a completely different person underneath. Surgery does that in a more permanent, invasive way. The goal is to move away from alteration of the self, of the person, and move towards, acceptance.
So alteration of self and permanency are two things that you brought up. Would you apply the same to tattoos and piercings?
Yes. When I think about aging gracefully, I think about somebody who is looking at the wrinkles on their face and going, oh, that was a laugh that I had back when I was, 23. This mark that I have on my stomach is from my child who's now in his 30s. Why don't we view that as aging gracefully? Why is there no grace in accepting the wrinkles?
One wrinkle or seeing a little mark on your belly is not what these women are coming in for. I've had patients who are so blown out in their abdomen that you can see their intestines moving under their skin after they've had 4 children. Sure. So is that okay now, or Maybe there's like this one definitive spot where like this is okay, but this is not.
So again, Dr. Nazarian is bringing up the idea that abdominoplasty or tummy tuck is a purely cosmetic procedure. It's not. It's commonly a reconstructive problem because of the muscles that have become lax following pregnancy or just with age.
But you want to keep your body healthy, natural looking, a very neutral canvas. And then you can play with it. You can have fun with it.
How can you play with your body in the terms that she's describing? Again, this surgery is not play. Surgery is real, and surgery has real consequences.
If a woman has 4 children and her stomach's completely blown out, her breasts are hanging down to here, you can't even show your waist, she feels so insecure that she hasn't slept with her husband in 2 years, should we just tell her to learn to love her body? Or should we do a 4-hour procedure in a healthy woman who's a mother who wants to feel like, hey, I want to be in a bikini again. I want to have intimate relations with my husband again and not be thinking, oh, is he touching flab here?
Yeah.
Oh, does my breast not look normal?
I think to have these procedures is certainly having a breast augmentation or breast reduction or abdominoplasty is certainly a reasonable request. I don't think you should be doing it to satisfy someone else, though, because again, I understand that people do it for other reasons where they may feel that they have insecurities surrounding their marriage or their partner. But what I'm saying is that is generally not a good reason to have surgery, because things can go bad and then it can lead to depression and withdrawal.
Do you feel like that is the most common belief amongst plastic surgeons, or do you feel like you're more of a minority of thought in that?
No, I think when I first started out, I was more of a minority of thought. This is my 11th year in practice, and I've always been into natural results. I haven't moved my forehead in 16 years. I have 15 syringes of filler in my face, but you would never know.
The reality is, if you look closely at her face, you do know. Just because she thinks she looks natural, it doesn't mean that other people think she looks natural. Yes, she doesn't look overly blown out and distorted, but there are certain areas on her face, if you look closely, that you can clearly see that she's had too much filler and possibly too much Botox.
I don't know that it changes the root insecurity that leads people to go and seek out plastic surgery. Do you all feel that insecurity plays a super large role in the choice, or you were doing it for yourselves?
Can I jump in there?
Yeah.
So growing up, I was super insecure. I had no curves. I was always made fun of for not having any curves, so that's why I have such an exaggerated shape now. And I always tied my self-worth to how I looked. And I feel like I was a victim of the plastic surgery industry.
This young woman is voicing her insecurities, and her response to those insecurities was to undergo surgery. And I don't think that is a legitimate way to approach the decision to have cosmetic surgery, because they're doing it for other people, so to speak. They're doing it for the outside world. They're not doing it for themselves.
Some people wear makeup, some people wear shapewear to make themselves, look slimmer or tuck in that extra roll that you might have after Thanksgiving, So I think insecurities are always going to have it. My question is, what is considered natural? Because if we keep going down that route of, this is considered natural, and who defines what natural is, right?
I think the way that I define it is that no one would know when you walked in a room that you had anything done at all. No stigmata of plastic surgery. That's how I think over the years.
Stealthy plastic surgery.
Yeah, like did she or didn't she? So I think that, if you think of it as prevention, if you think of it as self-care,
Maintenance.
Or maintenance, you maintain your car, you maintain your house. You also, if it's important to you, you maintain your appearance.
I think maintaining your appearance is a normal, good, mentally good choice. However, again, preventive medicine does not include cosmetic surgery, as far as I'm concerned. It doesn't prevent anything. You are making a decision to try to reverse some of the signs of aging, presumably in most cases, and that's okay.
We all feel insecurities. I'm pretty sure even now, no matter how much cosmetic surgery you receive, you're thinking of little things you can change about your body constantly. And we live in a world that really emphasizes image. Social media has really proliferated that problem. If everybody was using that sort of metric as a means of change, we would constantly be changing our bodies and faces. And I think it makes us more subservient to societal standards and other people's views, then we're subservient to accepting ourselves.
So I think that's a very valid point. I think that if you're overly obsessed with looking at yourself and trying to tweak things because this thing is, you're insecure about one thing or another, and you constantly are going back to the same issue over and over again, I think it's very unhealthy. And I think from a mental health standpoint, we have to question whether or not surgery is going to help.
I'm 26, but also there's younger. At the end of the day, what I worry about, like Botox and things that aren't really dramatic, like you can see I have plastic surgery, but the plastic surgery you can't see is what worries me the most. And I'm a little afraid of aging, I'm not gonna lie. So when I see like celebrities, they're like in their 40s or 50s, but they look 20, 30, do I have to do all of these things and stick needles in my face to maintain my youth? And that's what scares me the most.
So I think what this woman is voicing is a very important point, and that is when you start early and you start to have surgical procedures, where is the end point of when you're going to stop having surgical procedures? Are you going to constantly chase the rainbow of youth until you're dead? I mean, it is of great concern that when people start having cosmetic surgery at a young age that is significant in terms of altering their appearance, it may lead to depression and other secondary undesirable side effects.
When I was 18, I got my first boob job. I was going to compete in bodybuilding. Fitness was always a passion of mine before getting all the plastic surgery. And I thought I had to get implants to kind of like proportionately even out the rest of my body. I was getting like flat chested from the muscles and the chest days. And honestly, I don't regret anything I've done. I'm very happy and confident in what I've done to my body.
So I think that this woman is speaking with confidence that she made the right decision. And I think her decisions were appropriate because she seems to have comfort in the decisions that she made.
I'll scroll through TikTok and it's like, are you a cat girl or a bunny girl? What type of pretty are you? Are you slim bodied? Are you BBL bodied? Do you have A cups? Do you have B cups? And it's just people who are really funneling girls down this path of wanting a specific body type, whatever the body type may be, and trends flow in and out. And then I'm seeing young girls who are saying, I'm going to the clinic to get preventative Botox. It's not that I even have wrinkles now, I want to prevent wrinkles down the line, or I'm getting filler because Kylie Jenner has it, or
So preventive Botox is nonsense. I think that if you have a wrinkle later, you can treat the wrinkle later with Botox and it will be very effective. I don't think you need to start getting Botox in your 20s to prevent wrinkles in your 30s. And that also includes any fillers on the face. And of course, there's many of the young people emulate celebrities and try to imitate their look. And that's been going on forever. You know, it happened decades ago when people changed their hairstyle to emulate movie stars. But now, of course, there's a kind of non-invasive procedures like injectables and fillers where people are trying to emulate the images of their favorite celebrity.
Just so you know, though, in the plastic surgery world,
Yeah.
we have books on ethnic noses. We have books on ethnic breath. Like, we have books on this stuff to keep people within their...
To try and mitigate
Yeah.
the erasure kind of thing.
No, it's not. We don't even think of it as erasure, but just like respecting that person's anatomy and phenotype and just optimizing it for them.
What Dr. Nazarian has said is correct. There are different techniques for different ethnicities and races. However, certain people cross over in terms of what they want done. For instance, the Asian woman who's on the panel has had breast implants. That is not obviously a normal anatomic feature of most Asian people. They are relatively flat-chested relative to other races. So plastic surgeons commonly do not follow the ethnic outlines that many people think are natural features. In fact, they create abnormal deviations from those natural features. And I think they, in some respects, give a patient an unnatural outcome.
If you won't acknowledge where things come from, like, and you're just gonna hop on any trend that follows, like, oh my God, like, those type of eyes are in, I'm going on. Oh my God, like, big butts are in, I'm gonna go on that. Like, then you're just dumb. Like, you have to follow what you like more. Like, for some reason, I've never been inclined to get a boob job. You know, a lot of my friends have one. It's just like, that's not the look I like. I think we are in a generation where everyone's like so coddled and like so nervous. Like, oh my God, I have to look this way. And it's like, you don't look that way. So if you either change it when you get older, you don't. I don't know.
So I think following trends is a very negative way to approach cosmetic surgery. Again, when people have surgery and they're following their celebrities or whoever they think is looks better than them, it may look fine for the immediate future, but long term they may be buying into something that's going to be disfiguring and not pleasing to them when they're a little older.
Yeah, I hesitated walking up because I feel like if I was going to put it into perfect words, it's that I fall in and out in love with the way that I look on any given day.
Yeah.
And I think everybody experiences that.
Yeah.
But I've been sort of training my brain as I'm developing, growing into myself to care more about being healthy and having health. I feel like that exudes beauty in a lot of different ways. And knowing that the moments where you do not love yourself are not really founded in reality. There's just something that we're creating for ourselves, or society is creating, or social media is creating, that don't need to be listened to as much as we're listening to it currently.
Amala is expressing some very healthy concepts about being self-confident with her appearance and her health. And this is the type of patient who I think if she were to undergo surgery, she's going to do it for her own sake, to make improvements that she feels that will make her happier. She doesn't view the world as a place where they have to make other people happy in terms of the way she appears. So I think that's the type of patient I think ultimately will get satisfaction from cosmetic surgery. This Jubilee video has presented pros and cons of cosmetic surgery, whether you're on the side of having surgery and you're motivated to have it, or whether you're against having cosmetic surgery. Neither side is right or wrong. It's a personal decision. I have presented my philosophy on how I approach my patients when they come in. I feel that I am a guardian for their health and their welfare. That's first and foremost in my mind when I give advice to a patient regarding any procedures. Sometimes I don't think people are fit to have surgery, and I will tell them so because I feel it's in their best interest, not in my interest. So if you have any further questions, please leave them below. I'm more than happy to respond to them, and I look forward to seeing you in my next video.